In cholangiocarcinoma, I would say the cholangiocarcinoma is what I call a lukewarm tumor, right? It's not like melanoma where it's hot, but it's not like cold like pancreas either. There's some response to it based on at least a single agent study done in a refractory setting. But clearly, immunotherapy has a role in the treatment of cholangiocarcinoma because it's now currently approved in first-line setting based on the TOPAZ study, which is a randomized phase 3 study comparing Gemcis plus Durva plus Gemcis plus placebo. There was some synergistic activity. There was improvement in overall survival, slight improvement in PFS, also a higher response rate as well. So clearly it has it. The median overall survival difference is less than 2 months. It's very modest, but like all other immunotherapy, there's a coattail. You know what I'm saying? There's a certain patient population that really do benefit from the combination. So clearly immunotherapy has a role. Now, recently, the KEYNOTE study that used actually pembrolizumab plus Gemcitabine versus Gemcitabine alone had a press release just yesterday, actually, showing that was also a positive result, showing OS benefit. Once again, I don't have the exact numbers. I'm sure those will be presented in future congresses. So there are 2 studies in first-line setting in combination with Gemcitabine showing OS benefit. So clearly there's some role in it. So beyond that, what is the next step? Well, once again, in refractory setting, the data is not much out there, whether you use a single agent or whether you use a combination with other IOs. Data seems to be very modest at best. So I think the future is based on those TOPAZ study, based on now the KEYNOTE study showing positivity of immunotherapy in first-line setting. Maybe we could do a better job of adding maybe another drug to those triplet regimen to enhance the efficacy. Or I think is trying to figure out which of those patients do actually benefit from the combination, which goes back to the biomarker analysis, right? I think that's very important. The future is a biomarker analysis to sort of predict which patients will actually benefit from immunotherapy. And I think that's the future.